So there's a really interesting term that describes how obesity and diabetes are linked, and we now often hear the term diabesity because the two are so integrated and linked. Weight management, diabetes, the two are such a big problem linked together. We've known for ages that weight management and obesity is one of the key factors that influences type 2 diabetes. So we know that it's an overload of sugar in the system, insulin and the pancreas not being able to process this high level of sugar that we're eating. The diet that we're eating is just so unhealthy and not helping us to manage this kind of condition. Diabesity isn't an official diagnosis, but what it tells us is that obesity and type 2 diabetes are linked, and these conditions greatly increase your risk of heart disease, which is one of the leading causes of death globally. So I think what's important to understand is when you've got diabetes, it's not just a case of, yes, you can manage it by taking medication and not worry about it any further. I think often this misconception of, oh, I can go and see my doctor and take a tablet and then I'm okay, it doesn't matter. And often when patients are diagnosed with type 2 diabetes, they feel healthy and well. So they don't understand or really think more long-term about what the consequences and repercussions could be for them and how does that impact their health, their well-being and their futures. There are so many other complications that go hand in hand with having diabetes. So the risk factors associated between the two, I think, are really interesting to understand. So obesity in itself has so many different multiple complications, but when we're looking at obesity as a chronic disease, we look at, well, what are these chronic diseases and how are they impacting day-to-day lifestyle? And diabetes is probably one of the most prevalent of all of the conditions that we see in association with being overweight or morbidly obese. And so, yeah, that's a huge, big risk factor. But I think we need to think more long-term. What does that mean? Is that going to mean that there's a risk of heart attack, heart disease, cardiovascular impact? How does this impact my life in future? And is it enough to think, oh, I can just take a tablet and forget about it and it's going to be okay and that's the way I control it? Well, no, that's not the solution. You can actually prevent, control, and even reverse type 2 diabetes. And I know that for so many people, referring to the word reverse type 2 diabetes is considered to be controversial, that we actually put diabetes into remission and that we're not capable of reversing it. Well, I'd like to argue that we can actually reverse type 2 diabetes by really focusing on healthy lifestyle and changing how we live. So first of all, gestational diabetes, this is something that's really important to investigate, manage and explore for women who are of childbearing age and they're going through pregnancy. We want to try and ensure that they're going to be healthy, fit, well, and hopefully not be exposed to things like gestational diabetes, because that also increases their own risk for type 2 diabetes in future, but also the risk to the unborn child as well and to the children of the future. We've really got to look at what are the concerns there and how do we better manage that as an entire community and medical managed approach to ensure that we're reducing the impact of obesity on everybody and diabetes in association with that. In a Southeast Asian population, it is well known that type 2 diabetes can be an occurring condition at a much lower body mass index than in other Western population communities. So these are things that we need to look at. How has the influence of Western diet, for example, influenced the Southeast Asian population? What do we need to look at to change? So there's a whole plethora of conversations going on in that kind of mix. So it's a lot more complicated than just giving you one answer. So definitely we do have to look at hereditary conditions and family history. Familial history definitely can dictate what does that look like for you. So making sure that we're managing future generations and looking after everybody to prevent, improve and reduce the incidence of type 2 diabetes is really, really critical for sure. So rather than refer to it as a silent pandemic, I'd probably say it's one of the largest epidemics in human history. And the prevalence of diabetes in Australia is continuing to escalate at such an alarming rate. So 4.9% in 2018. And there are more men than women living with type 2 diabetes in Australia, but we're seeing these statistics just escalate in such a pronounced way that the cost as well, financial cost, so the economic burden of managing patients with type 2 diabetes is just phenomenal. In 2019, we were quoted around $598 million. So the cost of diabetic medications per capita increased by 165% between 2003 and 2019. So if we look at Australia, diabetes causes around 1.2 million hospitalizations each year and was the cause for about 11% of all deaths in Australia in 2018. So I don't know what our up-to-date stats are at 2023, but we need to have a future focus and vision around what are we going to do to reduce this. I'd call it a serious epidemic rather than a silent pandemic, and we definitely need to amplify the voice for what does this look like, what does it mean, what are the risks on our quality of life, on our lifestyle, on our future projection for healthy living. What do all these things look like, and also what are the other linked diseases in association with type 2 diabetes that could be prevented by managing lifestyle so much better. So overweight and obesity, poor diet quality, physical inactivity, these are all the things that contribute or make a difference to how we can actually better manage diabetes in our patient population. There's a report that came out of the United States, Diabetes 2030, a research paper that makes predictions for the United States. We can pretty much predict that Australia tends to follow US trends. So if we look at that, the prevalence of diabetes will increase between somewhere around about 54% between 2015 to 2030. And the cost of diabetes alongside that is increasing by 53% between 2015 and 2030. So maybe let's just take a moment to digest and absorb the impact of that kind of information and what does that mean for the world we're living in. It's not just exclusive to diabesity or diabetes in combination with the risk factors associated with being morbidly obese, but we need to look a lot bigger picture at the impact of obesity on our health, on our futures, and how we live. There's so many chronic diseases associated with obesity that we could be reducing, improving, and I would like to see eradicating in the future. But today we're just talking about diabetes, and the consequences are far-reaching because they are associated to multiple other metabolic conditions. Mental health as well is a big problem for people living with diabetes. So we need to focus on what does that mean to a diabetic patient? What does their quality of life look like, as well as their future trajectory and potential risk factors for so many other medical complications. So definitely, in terms of conversation, we need to look at developing healthier habits in childhood. Let's start with our children and focusing on how are we raising them? What are we teaching them about healthy nutrition and behavioural patterns regarding moving more, and things like choosing a healthy diet. Quitting smoking can make a big difference. Drinking less alcohol. All of these things are going to make a big difference. And we know that in a patient population, when you lose maybe even 5 to 10% of your weight loss can have a massive impact on your type 2 diabetes. So just thinking about some of the causes and things that we can think about so people can actually start to consider for themselves, and you've raised a couple of these already: age, family history, ethnic background, things like your body weight, diet, physical activity, having a look at your blood pressure, are you a smoker, alcohol, stress can be a big factor, and also sleep. So these are all of things that we can actually change. What are we actually capable of changing that can make a huge impact and help set us up to be so much healthier? Every single week we hear of patients who are pretty much off their diabetic medication, sometimes as early as 6 weeks post-surgery. So that in itself is huge, and if they can maintain weight loss but also increase physical activity and improve their lifestyle behavioural patterns, they're likely actually not just to get off the medication to be not just in remission, but to have reversed that diabetic kind of scenario and the risk factors for the future. It's literally something I hear about weekly. I don't think I go through a week without hearing a success story of a patient who, it doesn't matter how much weight we're talking about, it could have been 15 kilos, 20 kilos, it could be 100 kilos, but those changes in their health profile are so pronounced and absolutely phenomenal. And that's, I guess, more than anything, the highlight for me. The joy in seeing patients' success and achieving incredible results is firstly resolving medical conditions, changing the whole future pathway of what life is going to look like for them. And I just wanted to mention as well, some of the complications that go hand in hand with diabetes include blindness, kidney failure, heart attack, neuropathy, which means numbness, for example, could also mean sexual dysfunction. In some cases, there's extreme consequences, death. As I mentioned, 11% of all deaths in 2018 in Australia. So we need to be more mindful of ongoing consequences, risk factors, and links to other potential medical complications. So the first thing that we really need to do is focus on weight management. As little as 5% weight loss can be enough to help prevent type 2 diabetes. And for diabetes remission, we're looking at maybe 15 kilos weight loss in the early stages post-diagnosis. These are the things that we do definitely need to start being more and more aware of. If you're diagnosed with type 2 diabetes, you need to set that goal of 5 to 10% weight loss or more if your BMI is over 35. So these are the things that we're working on all of the time. And what we know here is that bariatric and metabolic surgery is 100% one of the first things you should consider if you're a diabetic patient and your BMI is 30 or greater. If you've tried other weight loss attempts and they've been continuing to be unsuccessful, or you're still in that yo-yo diet kind of cycle of trying to self-manage your diabetes, then I think that is when it's a good time to say, look, I need to reach out. I've got to look for something that's going to help me change my life and give me a future vision of good health, happiness, and a long future without having to worry about running around to see doctors. And when I'm talking to patients who are concerned about cost of weight loss surgery, I would like you to think about, what about if you don't? So if you've already, for example, got type 2 diabetes, think about what does that look like once you get to retirement, for example. The last thing I want to see is for patients to be doctor shopping in retirement, running around to see the endocrinologist, the cardiologist, and every single other specialist on the planet, when they could actually be living an amazing quality of life. Those are the kinds of things that come to mind for me. If we can start focusing earlier on weight management, better quality of life outcomes, reducing chronic disease and medical complications in relation to obesity. Let's treat the whole big diabesity epidemic, pandemic, whatever term you want to use for that, as effectively as we possibly can, and get on top of that now. Look, the first thing is, don't be sucked into thinking that you can just up the medication. That is absolutely 100% not your solution to managing and treating your diabetes or diabesity. And I think it's also important to understand that this needs to be managed in a holistic environment. And what that means is managing the mental health complications that go hand in hand with diabetes. We know that people living with diabetes are twice as likely to have depression and increased risk of anxiety. So these things are also important. In our environment, we cover all of these different pieces of a bigger puzzle to manage and help treat, prevent, improve all of the medical complications and conditions that are associated with being overweight. So making sure that we've got really talented psychologists. And I constantly stress this because for me, the value of having a multidisciplinary team when we're looking at treating obesity is much bigger than just treating obesity. So the mental health, for example, in association with diabetes, having psychologists on the team, and our dietitians, they are so important when it comes to looking at a patient who is overweight, morbidly obese, and suffering with a condition such as diabetes. What are some of the things that we can change and improve in their daily dietary intake and improve their dietary quality of food and nutrition every single day, working with them. So, just to reduce the burden of living with this, I think first of all, reach out and let us know, not only am I overweight and suffering with being overweight, and don't wait till that actually escalates. So if you're in that yo-yo kind of roller coaster ride where you're really successful at losing weight to help you manage your diabetes, but then you're continuing to go up and down and just not able to find that plateau where you can successfully maintain weight loss, that would be the moment to reach out. We see so many diabetic patients who are poorly self-managed, so I think it's really important to say we can help you. I guess my one tip is just reach out. Don't suffer in silence. Like anything else, suffering in silence is the worst thing you can do, especially when we know that there's a team who can really support, guide, help you. We have a nurse practitioner who's a diabetic educator and specialises in this space. So we're sort of really well equipped to cover every single aspect of management when it comes to patients who are dealing with diabetes and being overweight.